Almost there. Just let that go.
Oh.
All right. Okay, so I know we have the neck and then we have the lower back. You said both are pretty much equal in terms of which ones are the most annoying, basically.
Right.
You said the lower back started first. Okay. Was there like a specific incident that you remember that it actually started?
Could have been sports. I was pretty physical in sports. And
Yeah,
stuff like
I know hockey.
Yeah.
You said hockey was something that you did?
Yeah, hockey and soccer.
How long did you do hockey for?
I did it probably for a good, both hockey and soccer I did it for probably about a good 8 to 10 years.
8 to 10 years?
Yeah.
Okay, all right. And can you point to where you're feeling that lower back pain at? You're right in the center.
Yeah.
Yeah, and that's exactly that L5 S1. So where you pointed to, that's that one of that disc is pretty much almost gone.
Okay.
All right, let me go and just scan your spine again. Each time you come in, I want to make sure I scan this. So we did it in your first visit. We're going to do it every time you come in as well, okay? So let's take a look at what we're going to start off today, and we'll go from here.
There.
Yeah, you can feel it?
Yeah.
Yeah. Yeah, right where you feel it, that's where that needle just kind of flicks over. And so again, we're measuring for that inflammation from the spine where that heat just radiates to that skin. So both sides of the spine should be relatively the same temperature. But yeah, right there. Okay. But when it's not, one side's hotter, it's going to flick that needle. It's going to create a lot of stress on there. Okay. Yeah, right there too. Yeah, okay, so right there.
Right around that area.
Yeah, okay. Okay, so here's C5, 6, 7, 5, 6, 7.
6 and 7.
6 and 7 is the most tender. Alright, I'm going to just tilt you over to this side here. Yeah, C6 is the one. Doesn't move very well. 1, 2, 3, 4, 5. Yeah, I think we're going to start with that C6 today. 6, 7, 1, 2, 3, 4, 5, 6, 7, 8. This is T8, T9, 8, 7. 8,
Probably 8.
8, a little bit more right there. Yeah. And we got this lower back right here. And again, this is L5, S1, L5.
That one.
Yeah. Okay. All right, man. Yeah, so let's start on that L5. And, you know, especially what we talked about with that wear and tear, the longer it's been, the problem that's been going on, a lot of times people think, well, it comes with age, you know, I'm getting older. That's not necessarily true. You're fairly young to have that much wear and tear. And so once we start to see a problem existing, but it never fully gets addressed or corrected, that joint just continues to wear out. So we're going to work on that L5, that C6, and then that T8 in the middle, okay? All right, so we're going to get onto that C6. Right there. All right, so let's get you going. Now, your job's pretty easy. All you got to do is relax that shoulder for me, okay? Now, as you relax that shoulder, I'm just going to give a bit of a push right there, okay?
All right.
Dropping that shoulder. There you go. Good. Good. Now we just got to try to relax. Even just laying here, you're still real stiff.
Yeah.
Okay. So we're going to try to get you in as much of a relaxed position as possible. So just allowing your body to sink into the table. There you go. Good. Now I am going to roll you just a little bit, quite a bit actually. But your goal is just to relax. You typically sit on your wallet?
Yeah.
Okay, that's the first thing we're going to start changing here.
Okay.
Do you mind if I take it out?
No, go ahead.
All right. Now, you see how
That's pretty
thick this
thick,
is? this is one of our biggest problems for our patients when we're sitting on that thing in the car for an hour or longer or watching TV. Yeah, so do me a favor. You're even wearing a hole into your pants because of the wallet, so imagine what you're doing to your pelvis. Okay, so we're going to start changing that and putting it in the front pocket, or even just getting a thinner wallet and put it in the front. Okay. All right, so I told you before, 50% of the responsibility is going to be my part. You got to do your part too.
No problem.
Bring you over just a little bit. Leg up just right there's good. And scoop forward just a little bit more towards me. There you go. Right there's perfect. There you go. Rolling you just a little bit here. There you are. And as you relax that shoulder, gonna give a bit of a push here, okay? Drop that shoulder, let it go. Almost there. Drop. Let that go.
Oh!
All right.
That was much needed.
Yeah, it was. Go on up. 8. Yeah, so that's that T8 that causes you to go out to that side, and then it curves up back over here. So we're going to try to get that to close down, okay? All right. Good. Just let your belly sink into that table. Relaxing the shoulders. Let it go. Yeah, you were real stiff here, man. There you go. Good. There you go. Keep going. Just dropping those shoulders. Let your body just fall into that table. There you go. Good job. A little piece. One more. Good. That's it. All right. Yeah, we got some real good movement on that lower back. Even though, yeah, you felt that.
Been waiting a long time for that.
Yeah, man, that moved really well. I'm really happy because sometimes when those joints, they're real stuck like that, real narrow, they don't get as much movement. But that loosened up quite a bit. So I'm expecting some good things for you, man. Little by little, I mean, it's going to take us some time to get you where we want you to be. But we got some good movement on your spine, so we got a lot to look forward to, man. All right, good. Yeah, it's definitely reduced. It's still a little bit there, but it's reduced quite a bit. So we'll work on that a little bit more next time you come in, and we'll go from here. Good. Yeah, looking good, man. All right, so let's talk about what we did today.
Okay.
You remember how I talked about how your pelvis just dropped? We're going to deal with that later on.
Okay.
I want to figure out how you respond to just the adjustments first, and then we'll start adding some other stuff to try to level up that foundation for it, okay? Once we get more and more movement on that, then we'll start to work on that short leg on that left side. Now, as your spine, as it curves this way and it tilts down, we're going to try to get you to come closer to the center because your whole body leans to that left side. So even you'll notice on the adjustment, I'm really trying to close that down to get your spine to basically just shift and reposition there, okay? Even in your neck, we did that C6. That's the one at the very base of your neck. Shifting and moving that guy forward because, again, you've lost that curve. That joint is shifted back. I'm trying to shift it forward, okay? The mid-back, that's going to take us some time, especially because I always call the mid-back the melting pot of the spine. When you have issues above and issues below, the mid-back is trying to figure out what it needs to do. So there's a lot of wear and tear in there. So oftentimes it takes a little bit of work to get those things to loosen up, but once we get more and more movement in there, and the lower part and the upper part starts to stabilize, this becomes a lot easier to adjust, okay? So let's see how that does. Now, my job is done. Your job is to, when you're leaving out of here, get some walking in, okay? First thing is to get that wallet out, put it in the front pocket, but walking is your best thing, okay? Getting some movement in the joints, because now that we got that joint repositioned, walking helps to pump out some of the inflammation, okay? The other thing I want you to do, so we're going to give you some homework, okay? So we're going to send you out an email. You're going to click on the link. It's going to give you some videos that you need to start watching. It's going to talk to you about stuff that you should start to do and talk to you about stuff that we should stop doing as well, okay? So that's what you need to do for me. So that's it for today. Any questions?
Nothing.
All right, how you doing, man?
All good. Oh
Good.
man, that was much needed.
Okay, good. All right, man. Well, I'm glad you're here. I'm expecting some good things, man.
Cool.
And yeah, little by little, man, we'll get you where we need you to be.
Cool.
All right?
Sounds good. Thank you.
adjustments, man.
Thank you.